Welcome to Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, and today I'm so excited to be here with you. I have Dr. Lauryn Lax with me, and we're going to be talking about the German new medicine approach to thyroid health and beyond. I'm going to tell you a little bit about Dr. Lauryn before we dive into some of our questions. Dr. Lauryn Lax is a former TV news journalist turned functional medicine expert and health disruptor. After overcoming 13 chronic illnesses, 100%, she now empowers others to heal from the inside out through her total gut reset method. With 25 plus years of personal and clinical experience, Dr. Lauryn specializes in gut health, hormones, detox, mindset, and faith. Featured on CBS, ABC, Good Morning America, USA Today, and TED, she shares her story and expertise through books, podcasts, and online content. Thank you so much for being here, Dr. Lauryn. It's so great to have you.
Yes, I'm so happy to be here. Excited for this.
And I always love asking about what brought you to do the work that you're doing. I know many of us in the functional medicine space, it's not like we wanted to become lifestyle experts. This sort of career was just gifted to us. I didn't want to be a thyroid expert until I got a thyroid condition, right? So I'd love to hear about your story and how you came to do what you do.
I love that. That is so true because I think in the functional health space, it's so unique that a lot of the practitioners working in this space really do have lived experience walking in the shoes of a lot of the patients that we work with. And similar to you, my life path was actually not set up to be a functional medicine, gut health, optimization specialist. I was going to be the next Katie Couric on the Today Show. Really loved broadcast news journalism and worked in the newsroom for several years as a reporter and producer at NBC affiliates. And then life happened. And I say my story really begins back at fourth grade recess. So imagine you're a fourth grader, 10 years old, pink bow in your frizzy hair that your mom made you wear, and all you want to do is fit in. And so that day at recess, the popular girls invited me to join their gossip circle, where they're talking about like how cute Eric Arthur's freckly face is and how ugly Melody Smith's sweater is, and laughing. And then the topic of weight comes up, and the queen bee says, "Oh my gosh, you guys, I weighed myself last night and I'm 69 pounds. So fat."
Oh my gosh.
And then, turning to each of us, she just said, "What do you weigh?" And so one by one, we had to go around this gossip circle and report to our drill sergeant. And I was a healthy 80-pound, 10-year-old girl. But when the circle got to me, I gulped and I lied. And I said, "I don't know." And I just remember looking down at my feet and just thinking, I just want to be good enough. And after school that day, I went home, stood in the pantry to get my after-school snack, and never forget turning over a Dorito snack pack and learning a whole new language, which was fat grams and calories. And at age 10, my life path took a really sharp turn. And little did I know, like, that day would evolve into the next, 25 years of my life on a roller coaster of diets, dogmas, Dr. Google searches, doctor's offices, all in search for looking good in my own skin. And after that event had happened, it was like within a matter of months, 3 to 6 months, that anorexia took grip and hold of my brain, of my life, and really just of my soul. It was such a spiritual warfare, I would say, as well, walking through that. And my parents kind of caught on about 6 months into me dieting and just really wanting to be the most popular girl in school and wanting Eric Arthur to like me. And what started out as an innocent diet almost took my life. And my pediatrician, about 6 months in, just labeled me with that anorexia. And from that time, it became me versus the system. And so I don't know if your listeners are aware, a lot of, in functional medicine, we talk about treating root causes versus symptoms. The eating disorder space at that time was very symptom-based treatment and still very much is today. So similar to a person that has a lifestyle-induced chronic illness, we say take a pill for an ill. In traditional conventional healthcare, a person wanting to lose weight, just move more and eat less. My eating disorder was treated with the same thing, processed foods for weight gain. And so I spent 5 years accumulated of my life, I say behind bars and hospitals and treatment centers that really fought to keep me alive. But the typical treatments were Pop-Tarts, pizza, and Prozac. And so I lived in two very polarizing worlds where I was chasing whatever diet under the sun. I've done every single diet under the sun and would say I was a trendsetter for, I mean, if you ever heard of the fasting diet, it was like, that was the first diet. And then it went on to whatever was popular at the time, South Beach, Atkins, carnivore, vegan, vegetarian, etc. But I never really learned how to like heal from the inside out or to feel good in my own skin. And so I would get out of treatment and just run back to my old ways. And my eating disorder was about so much more than just wanting to lose weight. Like eventually it became more about control, achievement, identity, how I accepted myself. And it really was a reflection of how I saw myself. I think a lot of our healing in general, like from whatever our setback is or optimization, it's self-concept work. It's like how you see yourself is going to be what happens in your 3D reality. So I had just such poor self-concept. And so fast forward to age 23, where I wake up at 4:30 a.m., step on the scale like I do every single morning. I was in grad school at this time, only to see a number I have not seen since I was that 10-year-old girl. Only this time I'm a full-fledged adult. And really for the first time in my life, it scared me. And there was no doctors telling me what to do at this time. My parents they had done everything. They had remortgaged their house so many times and just trying to finance things that insurance would never cover and just loved me regardless. But that morning, I just remember driving to the gym at about 5 a.m. by this time and just praying out loud, God, help me make a change today, and just crying and just saying like, I am just so done with this. And when I was living in Nashville at the time, when I pull into the YMCA parking lot, I'm gathering my things out of my car, like my magazines. I read like Bibles on my Stairmaster for 3 hours every morning and my gym bag. And I hear a voice come up and say, good morning, Lauryn. And I turn around and it's not one, but 9 voices, 9 gym goers that step in and speak up and say they want to help me. And not knowing anything about my backstory or like where I'd been in my treatment journeys, they saw a girl every day killing herself on the Stairmaster. And just like that, there was something inside me, a spirit inside me. They knew I was meant for more. And so, long story short, they ended up taking me to Vanderbilt Hospital. And I just remember something inside me just catering and just being like, God, maybe this is an answer to my prayers. I didn't want to go to the hospital at all. Nothing imminent had happened either by this time. The doctors were like, what's going on? No bullet wound, no car accident. Within 48 hours, I found myself in the CCU with a heart rate in the near 20s and doctors saying I may not make it.
Wow.
As they're calling, we may need to call code blue on this girl. And by this time, my parents had driven in. They were living in Arkansas and they were at my bedside. But it really was in that moment, looking up at the ceiling and all these bright lights and all this commotion that felt so blurry, that I just felt like God said, Lauryn, you're going to make it, but buckle up your seatbelt. It's going to be a ride. And I just decided to live that day. And I knew that like, no matter what happened in that moment, I was going to be different on the other side. And no matter what happened in the moments and the months leading up after that, something inside me really just decided I am going to heal and I'm going to be healed to heal others. And so I ended up spending about 4 weeks in the hospital on heart rate monitors and feeding tubes and IV fluids, just kind of like getting back some life in me. And at the end of that, the doctor said, you have one of 2 choices. You can either continue to stay here in the hospital or you can go back to treatment. And I chose the latter. I wanted the feeding tube out of my nose and decided to go back to treatment on one condition. I would be there 6 weeks, the minimum stay, and then I was going to peace out. I'd be well. At that 6-week mark, I was in treatment in Miami, actually, of all places, and my heart started having like these chest pains again that I hadn't experienced for weeks by that time. And I felt like it was like God saying, Lauryn, I'm not done yet. And so decided what was going to be a 6-week stay ended up being a year long in treatment. And treatment itself had not changed. It was the same, Pop-Tarts, pizza, Prozac, but like I had changed and just decided again, when I got out, I was going to have a new opportunity. And I did. And I got out in Miami and just began to like learn to walk again after crawling and just do life in a different way. And I stumbled into CrossFit and paleo, which was popular at the time within that community. And like that was the segue actually into functional medicine. So found one of my mentors, Chris Krusser, was kind of involved in those worlds. And that's what really began to give me a different lens on like how you could feel good and actually heal from the inside out, not just mask symptoms. And even in the eating disorder world, when I would get out of treatments earlier on, a lot of times it was like, you would look good or better on the outside, you gained weight, but my gut was a wreck and my hormones were a wreck and just the inside still had not healed. So functional medicine was a gateway. And why I love the gut so much is when I learned how to start healing my gut. That's like when the light bulbs in my mind went on. I started thinking differently about everything. My anxiety went away. My bloating and constipation went away. My hormones began to rebalance. And there was just so much healing that happened in that aftermath and learning that. And then I was blessed on the back end of all that to be healed from the eating disorder. But what I did not foresee would be the journey for the next decade, which was like all the years of stress on my body. And that's kind of what led to those 13 illnesses creeping up over time. And just my immune system and gut and stress levels had really been through the ringer. And so ended up being diagnosed with like 5 different autoimmune diseases, Hashimoto's being one of them.
Yeah.
Lyme, mold illness, co-infections, diabetes, heart disease, like the list just kept growing. And it felt like there's a movie called Girl Under Fire, I think, or Brain Under Fire, something like that. And it just felt like an out-of-body experience. But similarly, when I just decided I was going to be well, and I consider it my best underground medical school. So it's really, during that interim, I had started my practice already, and then I became a patient again in many ways. And I'm in 100% remission from everything today. And just like, it was like the shackles fell off as not only as I continue to lean into the functional medicine, but I learned German new medicine, which we'll unpack a little bit, and just really healing health, head, and heart, which is what your gut impacts it all, which I think a lot of people hear total gut reset and may think digestion and constipation and bloating, but it really is your first brain. Some people call it your second brain. And then it's the core view of who you are. It's the soul of who you are. And so I address each of those facets in my work with clients and in my programs now.
Wow. You've been through so much and you are just such an inspiration. Thank you so much for sharing everything that you've gone through and having such an open heart. And, you know, I feel like you are like the wounded healer. So you go through this journey, and sometimes we ask ourselves, like, why me? Why me? Like, why is this all happening to me? And then, you know, you went through your one journey with the eating disorder, but then you also went through this whole other journey with, you know, you probably thought you were healed at that point, and you were hit with so many other health conditions. And I feel like it's given you so much compassion for others. It's taught you so much, probably lessons you didn't really ask for. But at the same time, I feel like you're very grateful for what you went through.
So much so. Like, I think life is always happening for us, not to us. And it's fun when you begin to see your life as like the movie plot of your life, of whatever is happening. If it's health related, or if it's a setback financially, or if it's something in relationships, it's like, how do you want the story to go or the movie to go? And I call it the bridge of incidents. It's only like the in-between of here and there. And it makes it more fun, honestly.
I've had, you know, I kind of went through a healing journey in my 20s to heal myself from Hashimoto's, and then new motherhood, exposure to mold, all of these things really humbled me because I thought I had everything figured out. And then all of a sudden, mold kind of came into the picture, and I was like, wait a minute. I thought I had everything figured out. I thought like I just needed to eat like a really clean diet and take my supplements and everything would be gravy, you know, and that's just not how it is. So I totally can empathize with what you've gone through, just the challenging journey. And I think it's made you a much more powerful healer and helped you get to know yourself, right? Like, and allowed you to realize what you're really capable of. I feel like, you know, we kind of have this journey where we go through the day that we're born, and then we go through the day that we figure out what we're meant to do. And there's like this transition. I know I heard you say it. For me, I was sick with Hashimoto's, and I would look in the mirror and I would say to myself, I'm Izabella Wentz. I'm in charge of my own destiny.
Oh, I love that.
And I don't know what really brought it out for me. I think I just got tired of being tired and I got tired of the status quo and I didn't know if I could heal. I feel like being trained in conventional medicine as a pharmacist, it just was like, you went through it, I'm sure, with conventional medicine,
Yeah.
the treatment for eating disorders, just eat a whole bunch of carbs. Never mind that they're going to send your blood sugar crazy and lead you to have anxiety and more cravings and more rumination and more,
Yeah.
just kind of lead you down through a vicious cycle of weight
Not
gain
feeling
and
well.
feeling like crap and trying to take control of feeling like crap and whatnot. What do you think it was for you that day that led you to decide that you were in charge of your own destiny?
That's a beautiful question. And it honestly just felt like a lightning bolt struck in me. And it was just like, I call it the no more moment or the light bulb moment, where it was just like everything had just like not worked to that point. And I had really, I don't even like victimize myself in it, but it just like I had been in submission to everyone else but my voice and like God's truth in me. And it was just really a taking back of power, just like it sounds like for you it was. And I began to like have a new battle cry. I don't know if you remember the WWJD bracelets back in the day, but yeah, I would say like, what would healthy me do? And that would just like really help me align to like my higher self, because it was like, again, learning to walk. And I didn't know who this girl was, but I began to create her.
I love that. I think, you teach about mindset, and that's such an important thing for people when they have chronic illness, because it's so easy just to get stuck in that vicious cycle. And I think, for me, I was like, I remember I bought new clothes. Like, this is what the new me would wear. And this is what I feel like as a healthy person. And I'm a big proponent of using journaling and just kind of envisioning what you're going to look like, what you're going to feel like when you're healthy. And then also, like, how do you have that right now? How do you connect to that right now? So even though you might not have met your health goals, but how do you pull from it? What are some methods you use with your clients?
Yeah, I call it like that girl or that guy, or like kind of designing who that version of yourself is that you desire to be. And it's not like someone else's. It could be a hodgepodge of people you admire and qualities and characteristics, but it's really designing who that is. And I'll start with like a brain dump though for folks to just really like get all the stories out of your head or the limiting beliefs that you have about your current situation. It could be even as simple as like the diagnosis you've been given. Like until we reject that diagnosis, like I am anorexic, like until I reject that belief, then I just continue to play that out. So it's brain dumping, not only maybe diagnoses or things that you think are 3D realities right now, but also just like the I'm not good enough story or whatever is going on in your head. Like I shouldn't eat carbs after noon, rules that you have for yourself, etc. And then for each of those, I'll ask my clients to like do a counter truth to that. And so like what would higher version of yourself like say to that? Or if you have a hard time thinking of that, like it is finding the evidence and truths elsewhere. And so I had a client actually message me earlier, and it was like she felt like she had overeaten that day. And I was just like, actually, that's called metabolic flexibility. And when you eat more, your metabolism actually revs more. So it's like, oh, like a new paradigm way of thinking. And that's where just like functional truths can really come into play. I'll do scriptures to those. So it looks different for everyone. From there, then I will have one like myself or someone else design who that avatar is. Like if you were playing in the movie of your life, you're the star role. Who is that in all areas, like in your health and your physical body and the thoughts and things that you say? What is your morning routine like? Where are you living at the time? And just be as creative and vivacious as you can, because if you can imagine it, it can be real. And then lastly, from there, I'll develop like gut love mantras from that. So a mantra is kind of like the what would healthy me do was like a battle cry for myself. Yeah. Or when I was recovering from mold, it was like, I'm strong, I'm resilient, the mold can't hurt me. And I would just rampage on that mantra, sometimes even do EFT tapping. Like this is your pituitary point where stress is saying mayday, 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 old stories there. So I would just like embed a new belief. So if I'd go to like a hotel and be exposed to mold and my body's starting to react, I would just like strongly say that for like 5-10 minute rampage, to the point it's like hitting your head with a baseball bat on a cartoon and you see the dizzy stars. Like you forget the old story because the new story begins to take over. And at a cellular level, we know like our words and our beliefs can change our body. Like if you've probably heard of the study where they took the water like and spoke loving thoughts to one cup of water, hateful thoughts to the other, the water looks completely different under a microscope. Like looks like beautiful snowflakes and then looks like mean, jagged, angry edges that are like disintegrating against from each other. And just depending on what we're saying to water. We're 70% water in our body. So that would be kind of a method that I take people through.
I love that. On my first healing journey, I would say every day in every way, I'm feeling better and better.
I love that.
And on my second healing journey, I would say I healed myself once, I can do this again.
Yeah.
And I would just say that to myself every
Evidence.
single day. Words are so powerful. Even what you said, it's like saying I am anorexic versus I am a person. I'm a beautiful, smart person with anorexia.
Yeah.
And people will say like I am fat. Like you are not fat. You
Yeah.
you might have extra fat somewhere, or I am this, or I am that. And they I guess embody their diagnosis.
The identity.
And I feel like that becomes a part of their identity. And that's just so much harder to heal versus saying like I am healing from a thyroid condition is so much more powerful to say that I'm like a Hashimoto sufferer,
Right,
or
exactly.
I'm, like it's just so powerful.
Separating from that old identity to become the new.
I love that you do that. I wanted to pick your brain a little bit about toxic mold illness. Every few years, there's like this trend of like, when you have this is like the worst thing ever and you could never heal from it. I know many years ago, it was blastocystis hominis. Like people could just not heal from this protozoal parasite.
Yeah.
And it can be a common trigger for Hashimoto's. And I was like, you know what? Saccharomyces boulardii works really well for it. And like, there's a few there's meds and there's these herbal remedies and there's like, sometimes like there's like an easier path or the path of least resistance. What are your thoughts on mold? If you have mold exposure, are you just going to, be stuck with it forever and you're just, if you're just going to be sick forever for the rest of your life?
100% no. Like I do believe like healing, and since learning German new medicine, which we'll unpack shortly as well, like it's really even more autonomy. Like we are not a diagnosis. Like a lot of times, even from my story, like I think healing is metaphorical as well. Like there were symptoms or metaphors for bigger things going on in your life. So with mold illness, there's usually stressors that precede that as well. So during the time that I got sick, because I will contextualize it, I'd lived in toxic mold many times before I got the sickest with toxic mold. Like if you've ever lived in a college dorm, you lived in toxic mold. And growing up, my parents' house had mold. So like what separates like the times that I lived in mold to the time that I lived in mold and got the sickest of all? And yeah, there could be magnitude differences in mold, and some homes are moldier than others, et cetera. But in our resiliency inside, it's really going to make a big difference too. So like the healthier and stronger your, like I call it your gut bug army is, the more resilient your immune system is. And a lot of times that immune system gets diminished with a lot of stress as well. We know how the HPA axis works. So, and sometimes it's the perfect storm. It's like mold can affect so many different parts of the body, like as far as symptoms wise, and no two people have the same symptoms. Like you can have brain fog, you can have gut stuff, you can have all this autoimmune stuff, skin stuff, etc. And every symptom has a metaphor. So for example, if a person's breaking out on their skin or they're getting eczema and rosacea, living in mold, that's triggered that can be related to an attack conflict, and not just feeling under attack from mold itself, but like in their life. Like maybe they're going through a really stressful lawsuit at that time in their business with a partner, or maybe it has been like with a partner that is not being supportive, or if it's eczema, like that's an autoimmune condition. So we know that's like a self-devaluation conflict. So a self-attack. So like there's something exacerbated where they're not feeling good enough in some scenario, where couple that with living in the moldy environment, the mold is the trigger for it, but it's like how the mold presents in the body depends on what's going on in our life stress wise. My body in my toxic mold home was just like mayday, 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 like so many symptoms where again, I'm being diagnosed with something every like 6 weeks. But it was on the tails of like a very stressful season in work where I was working like 12-hour days, kind of like in the early stages of my business and just like balls to the wall, got to get things done. I was living with a stressful roommate who had a cat that I was also allergic to, and that was very stressful. I think overcoming the eating disorder as well, like just the back end of like how the stress had built in my body. So that was unique to me. And so everyone that I speak with typically that's going through mold, there's usually a stressful season and it may not, we diminish stress so much in our society that we don't even sometimes see stress as stress. So it could be like they just had a baby and then they're going off maternity leave and internally they just want to be a mom and stay home now. And that's stressful to go back to work. And then they're living in this home, et cetera. So really all that to say, like your question about healing from mold, I think it's more so figuring out root causes of what made one sick and addressing root causes. And then as I've addressed root causes physically and mentally, emotionally, my body is strong, resilient, and mold can't hurt me. And I am never going to live in a black toxic mold home again by choice. And I am a canary in the coal mine now. Like I can really sense mold, but I've gotten even stronger to the point where I can go in buildings, whether it's like my church or Whole Foods downtown or Target, be exposed to mold and just be like, interesting, I smell it. Or go on a trip. A lot of hotels are very moldy and survive in the mold. And I know what to do too to offset it. So if I get exposed, and that's like, I think teaching people how to just kind of like get their head above water first and foremost with their health, and then being able to like detox it. Like I love saunas a lot. Glutathione works really well for me. Vitamin C works really well for me. Just fresh air, hugging a tree. Actually, I had a mold mentor, just like feet on the earth.
Earthing.
Yeah, exactly. To kind of like offload some of that.
I love all of these suggestions. And it sort of brings up, you have the environment that's outside of you, but also the environment inside of you. So if your gut health is intact and if you're detoxing well, you're not going to be as impacted as somebody with like immune dysfunction, right? Exactly. Or somebody whose detox pathways are a bit overloaded. And so then like having that mindset is so important, but also having the toolkit of what to do if you are exposed. And I feel like that's kind of the beautiful bridge between mindset as well as functional medicine.
Yeah, definitely. One thing I'll say is kind of piggybacking that is like, if your cup is full too with toxins is where you can be more susceptible to toxins. So I've worked with women that maybe they've been on birth control for a very long time. That's a xenoestrogen. And then they maybe go get some treatments done that is xenoestrogenic, like aesthetically, or they've gone through a surgery or something like that. Like maybe they got breast implants or something like that where there's more xenoestrogen in the body. And then their diet's okay, hit or miss. Then they get in the mold. Their body is just kind of like, my cup is full right now. So like bringing in more xenoestrogens, whereas maybe some of those other things, variables weren't there. The toxic mold wasn't there. They don't feel it as much. And then there's a tipping point on the physical as well. So learning how to offload, how to support your detox pathways, which we have like 7 channels, not just your liver, but like your lymphatic system, your circulatory system, your skin is a detoxer, gallbladder, your kidneys, your colon, and your lungs. Like learning how to support what is weaker can help.
I feel like not many people talk about kidneys, and I'm going to ask you a bit more about that.
Yes,
but that's such an important topic. Yeah. Before we get into that, I wanted to know how your training as an occupational therapist shaped your work. I have being a mom, I've learned so much about occupational therapy and all the wonderful benefits, and it's just such an interesting body of work.
Yeah, it's such a random career path that I ended up in too, because like I said, I was in the newsroom and a reporter and producer for many years and decided it was actually my anorexia that I was so sick. My parents weren't going to support me. They were like, you're on your own. And so I was like, okay, I'll go to grad school because grad school can support me. Like I can do loans. What will I go to grad school for? While I was wanting to do something different. And so chose occupational therapy, and it ended up being an amazing career path for me. And if you're not familiar with OT, occupational therapy is really all about helping individuals live life to the fullest, whatever that means for them. So in its many different contexts, if one has had like a traumatic brain injury or spinal cord injury, an OT is working in rehab to help that person learn to dress themselves again and feed themselves again. If we're working in like pediatric clinics, maybe with kids, whether it's on autism spectrum, ADHD, OCD, a lot of anxiety, helping kids learn how to function with their peers optimally, how to like regulate their own emotions, helping them learn how to focus, use fine motor skills, et cetera, et cetera. So we're doing a lot of games with kids. The type of OT that I ended up specializing in is called lifestyle redesign. And so it's really helping individuals think about like, who is that avatar self, and like really living that to the fullest. And so that would include, if you're familiar with Maslow's hierarchy of needs, like we have like the basic foundations of like good food and shelter, obviously, but sleep and hydration and movement, like what makes an individual just like a human, helping them there in order to get ultimately to self-actualization at the very top. So that could be like, what are their goals, their dreams, career path wise, or it could be like in their relationship context. It's very unique to the individual, but I think it's a perfect pairing with functional medicine, because functional medicine is about helping individuals optimize like their health wise. The interesting thing about OT, I didn't know until the back end that I became a gut specialist too, is like helping individuals optimize like their digestion and like their just body function is a big part of our framework as well. So it's really been a perfect pairing of both like the lifestyle and the psychosocial pieces of the work that I do with clients, as well as the physical health pieces. And no one teaches us in school how to regulate our blood sugar or how to, I don't know, like anything about health, actually, like sleep optimally. And we know what the food guide pyramid taught us about eating wise and everything. Thankfully, hopefully it's going to change a little bit as things are changing in our just like way we're approaching health as a nation. But yeah, that's a little bit of OT. So it's been a perfect like just pairing and just like accelerator for what I'm doing.
I love that you're bringing that perspective, because I've just learned so much from OTs, and I used to work with individuals with developmental disabilities, and that's where I first learned about occupational therapy, and it's just incredible. It's really thinking outside of the box outside of the pharmacy pill box for me, where how you can support a person and teach them new skills. And I feel like with, I love supplements, but that's just kind of one piece of the puzzle. And how do you develop these habits for success? And how do you get to that place, right?
Yeah, definitely.
One thing that I wanted to talk about, and this is, this can be very controversial. I think if you're coming from an eating disorder background, I talk about healthy foods, right? And I talk about eating a clean diet. And there's a slippery slope between healing yourself with food and food as medicine and like orthorexia and diet culture. And I feel like, you've gone through it yourself and now you help others with it. What are your thoughts about that? I know I've gotten to a point where I was like, I heard gluten and dairy helped me getting off of those two foods. And I was like, I just need to eliminate more foods. Maybe that will heal me. And I got to a point where like my skin was lackluster and I lost too much weight. My hair was falling out. And I was just like very thin, eliminating more and more foods. And I felt like crap. And so I would love for you to maybe talk about some of the psychology of food and, your thoughts on this, developing a healthy, sustainable relationship with eating and all of that.
Definitely. Oh man, there's so much there. I like to think a lot in terms of abundance mindset versus restriction mindset when it comes to food. And when I'm working with a client, like teaching them like what is real food. And like that's our body is meant to function on proteins, fats, and carbs. We know this. And like, what are the optimal sources of those? Like the most nutrient dense sources that like, if it didn't grow on the ground, swim in the sea, roam the earth, it's not real food. And like just knowing that food can't hurt us. And I think there is a lot of like dogma, and it just changes depending on the decade or the era. So at one point, like
what's trending?
Exactly. Whole wheat is great. And then it's like carbs are really bad. And then we've got protein, meat actually is coming on to be a cool thing, more mainstream now, but it's like been a more plant-based for a while. And we know like within the carnivore space, that sometimes can also go to the extreme where we're just like scared of like
broccoli,
spinach, like whatever it is. And so I think we are also like not what we eat, we are what we digest. And so like when we help individuals optimize this, we're able to tolerate so much more. So for those that are like, oh, like I just can't tolerate broccoli or something like that, it's like, well, like, I mean, is it well cooked? Like, that's one way of digesting it, but like, how is your gut microbiome? And a lot of times individuals that I've seen like going on like super animal based or the opposite, vegetarian, like whatever band camp you're in, there's some gut dysbiosis going on, or like low HCl for those that can't tolerate meat, and it feels like it's sitting like a brick in the stomach. So I focus more on the inside versus the external, whereas a lot of the diet climate, even like the healthy eating climate, is just focusing on topical. And so when we heal the inside and optimize the inside, we're able to have a more broad range of like the proteins, fats, and carbs that are optimal for humans to survive and thrive, that may mimic what our great grandparents would have eaten. I always think it's interesting too to just like compare, like, yeah, think about your great grandparents, and they were eating foods like steak and potatoes, or even Wonder Bread when it first came on the market. We know the ingredients were like 3 or 4 ingredients that was so different, but they ate real food more, and it's like, and their gut microbiomes were just different than they are today. And so I'm a kid of the processed food generation, grew up on like Lunchables and fruit snacks and all the red dyes that are now being banned too. So my microbiome was just not seeded to be well. And so like that teed me up to be more sensitive to all sorts of foods. So I really focus just like on health as an inside job again, like let's heal the gut, and then just try the least restrictive as possible is a sign of a healthy microbiome. And then all within a context of 80-20 balance too. So like when in Rome, try the real pasta. On your birthday, have a treat that like speaks to you. It could be like you love carrot cake, you love ice cream, you love coconut ice cream from Gotti's, which is what I like. So whatever you're going to choose, like, and your body is not going to be so wrecked by it. And so I help a lot of people undiet and like reverse diet, basically from those that have been pigeonholed into eating maybe like 5 foods, because it may not be an anorexia or eating disorder mindset by this time. It's like all their body can handle.
Yeah.
Because again, the microbiome has just been so depleted. And if you can imagine like a wasteland, like where there has been a drought, it's very dry. Or a famine, it's very dry. And so, or just like there's not much there. So that's what can happen to the biome when we're not feeding it a variety of foods over time. And we're doing it because we're not wanting to exacerbate symptoms. So it can, that which was once productive can become counterproductive. Like if an elimination diet was prescribed, I think an elimination diet for by and large the American population can be helpful way to like kind of like clean the windshield. But it's not meant to be like forever that you're eating such a limited amount of food and you're just not feeling well outside of that box either. That's a sign still of an unhealthy biome. If, say, you are eating like a sweet potato and you're reacting, like again, real food here, or you're eating some steak and it just feels like it's not digesting. And then there's a lot of variability too, depending on like, I think our epigenetics play a role in that, and just genetically where we're from. Like I'm a meat and potatoes girl by like my ethnicity and like in Germany, whereas like those that maybe were like in the islands, like from there, like they do really well with a lot of tropical kind of foods and fruits and stuff like that, and different varieties of like even like keto, carnivore, vegetarian, where you can have a skew maybe towards a type, but it's like not completely an elimination either from the other foods. That makes sense.
Yeah, that makes so much sense. And thank you so much for talking about that. I know for a while it was like, you have to be autoimmune paleo if you have Hashimoto's. You can't do the keto diet if you have Hashimoto's. And then there's people that are like, oxalates are so bad for you. Yeah. And the longer I've been in functional medicine, I'm like, oxalates can be an issue if you have a candida overgrowth, if you have a mold overgrowth, because they could be producing oxalates. If you have a P5P or a vitamin B6 deficiency, because that's what's needed to metabolize them. If you're taking too much like glycinate, magnesium glycinate or glycine, you can upregulate that pathway. And it's kind of like, you're not meant to like, oxalates are not evil.
Exactly.
And the same with like meat. That's not evil. But if you're eating it and you feel like terrible, let's look at your stomach acid. Do you have an H. pylori infection? Yeah. What's happening there? Do you need to support your stomach acid? And I feel like, I kind of try to be very respectful of diets, but I also want to be mindful like of dogmas. Like just because you feel amazing on this diet does not mean that all the foods that you're avoiding are evil, right?
Yeah.
Like it doesn't mean that everybody needs to be on this diet. It doesn't even mean that you need to be on this diet long term.
Totally. And I think there's also a psycho component to it as well, like a mindset component to what we eat.
Yeah.
And I've introduced every single food I was intolerant to, like real food wise, that I wanted to reintroduce because I made up my mind. So for example, I used to like not tolerate almonds or nut butters and stuff like that. And I'll never forget like having a smoothie, my favorite place at the Well downtown, which I now, they call it the Lauryn smoothie, but it was like the day of psyching myself up. Like there's nut butters in this, there's nut milk, and just being like, I can tolerate this and desire, like wanting to do that and wanting to be more normal where I could order off menus and not just like have to be so restricted to bringing my own food everywhere like I used to. And then kind of, if you think about food intolerance is a psychosocial component to it as well. Consider like little Johnny as example. He's 8 years old. He eats a peanut butter and jelly sandwich every day for lunch. He has for years. I did that for years.
Sounds about right.
Exactly. Then one day, out of the blue, he starts to develop hives and like tummy issues. So his mom's like, what's going on? We're going to go to the pediatrician. The doctor says it must be a gluten intolerance and peanut allergy. Cut those out. We'll see how he does. Little Johnny improves. Like he feels better without those things in. Well, when we do the work and figure out what was going on in little Johnny's life around the time he became intolerant, segment like different from when he wasn't, come to find out little Johnny was eating a PB&J at the same time he witnessed his parents in the kitchen have an all-out fight that led to his dad walking out, eventually separation and divorce. The way his brain locks that in is it's the trigger, kind of like the mold was the trigger in an earlier analogy, where it begins to link PB&J with stress, an indigestible conflict. I cannot swallow this or digest this. He's not thinking that about the PB&J, but it's at a subconscious level where the brain begins to see these foods. And I think a really interesting paradigm to also consider would be like a food desert compared to like yuppie downtown Austin, where like you go to like True Food Kitchen, be a fly on the wall, and it's like we're substituting everything like seed oil free. Obviously, we like that, but it's just like all the requests compared to like these eating Cheetos and pizza and like not recognizing symptoms at all. They have different problems in a maybe food desert that they're thinking about, nothing to do with food. Whereas we can be hyper focused on the food and knowing how our body feels and reacts to everything, that we kind of continue to exacerbate the issue based on like how we're thinking about it. So
I mean, it's so true. I feel like emotions play such a big role. I remember one time I was, my husband and I were living in the Netherlands, and I just picked out some like beautiful vegetables and some meat. And I was doing a stir fry. Everything was like fresh, organic. And I don't know what we got into a fight about. Really could not remember, but we got into a huge fight. And I ended up eating the food, and I got sick from eating the food, right? And there was like nothing wrong with the food, I don't think. I think it was my emotions that led me to reject the food. And I feel like that's such an important thing to consider is like, when you support your stress response, and some people, you know, they have this acute stress, but when you're going through a family divorce or some kind of trauma, oftentimes that stress stays with you, and your underlying stress response can guide your food sensitivities. And part of healing food sensitivities is really healing that stress response.
Definitely. I can't tell you how many clients have gone on vacations, like away from being business owners, work, and they're like, Dr. Lauryn, I just felt amazing and I was just eating everything, whatever I wanted. Yeah. And like, it's so different. Like it must be, the difference in the food, but it's really also the stress.
I hear about like, oh yeah, in Europe, gluten is just fine. Yeah. And they're like, it's just fine. I'm like, listen, guys, I have clients in Europe. Yeah. It's not like their gluten is that much different. There are people with gluten sensitivity and celiac disease in Europe. Yeah. It's part of the vacation honeymoon effect, right? You're much more relaxed. Yeah. And maybe there's a slight protein variation, but if you were to live in Europe and eat all the food with time and you still had that impaired stress response, you would still have reactions. Sensitivities. Something that I'm really fascinated with, and this is one of your areas of, you have so many areas of expertise, but this is one of your areas of expertise, is German new medicine and the kidney tubule conflict. I mentioned I had a second health journey.
Yeah.
And this happened during the pandemic, and I was a new mom. Prior to the pandemic, my mom and dad would come and visit and help out. We had this beautiful dog. I had just a lot of community support with people, whether it was like helping me clean the house or helping me with meal prep and whatnot. And I just felt like I was super supported. And during the pandemic, my parents stopped visiting, and they actually had our dog in Chicago with them. And so it was my husband and I, and we were on lockdown in Colorado. It's like the middle of the winter. Can't really go outside because it's so darn cold with a 2-year-old. Can't really, go to people's houses. Can't really go to, I used to go to fun baby classes and have this beautiful community of women that I would get to spend time with. And I felt so isolated during that time. And out of nowhere, I gained 20 pounds. I started showing symptoms of premature ovarian dysfunction. And with time, I ended up, trying to figure out what was the root cause. And I ended up seeing a Chinese medicine doctor who talked about kidney deficiency from a Chinese medicine perspective, and like feeling isolated and feeling like you're losing community or being like an outcast from your community, unsafe, abandoned, loss of community, fears of survival, so on and so forth. And I was like, oh my gosh, that really aligns. And I know that German new medicine, this is what you talk about too. I believe you have a blog on this whole thing that I'm going to link into the show notes. Can you tell us more about that though?
Yeah, there's so much life to the kidneys, and I think they impact us stress-wise because the kidneys and adrenals also sit on top of each other. Yeah. So most people are familiar with the adrenals. You've written a book on adrenals, and like that's where a lot of cortisol is pumping out. And so, the kidney collecting tubule conflict is a lot of times what we'll see, just like this malaise of symptoms. So we see like weight gain happen, especially a lot of times rapid weight gain, hormonal imbalances, PCOS, some autoimmunity, and just like not feeling like yourself, even a lot of thyroid conditions actually out of it. And so the kidney collecting tubules conflict, you can say that 5 times fast. It's a lot, but it's also known as like beached whale syndrome or like fish out of water syndrome. So it's like where you feel like a fish out of water. So as a fish washes up onto the sand out of the water, what do they do to preserve their life? And so it's like the body begins to like store water and like really like the swelling, the bloating, etc., to help this organism survive on the sand while it's out of its element. And so it's like a feeling of being out of your element, like COVID kind of like ripped that from you. And then with at a psychology level where you're just like thinking mayday, 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 I'm trying to survive. And like what your Chinese medicine doctor picked up on there is like the fear of existence. Specifically, like in German new medicine, there's like 4 primary conflicts. You don't have to experience all of these, but it's the AIRE conflict. So it's AIRE, abandonment, isolation, refugee, or existence. So abandonment could be just like you knew you weren't abandoned, but feeling of abandonment.
I felt abandoned.
Yeah, exactly. And just like alone on your own island.
Yeah.
Kind of like trying to like keep your head above water with everything as a new mom and just like no community and like parent support now. I just feel like, man, abandoned. Isolation can be similar as well. So just like feeling
Pandemic.
all alone, 100%. Pandemic, perfect. Think about how many people gained weight during the pandemic. And yes, there could be a stress eating component that can be part of this, but it's like you can also just be holding and retaining on weight. I was working with a client who feels like she just broke up with a guy that she was talking to, and like she's gained 10 pounds like in a week, and she's like nothing has changed. Like she's now trying to diet harder, like but nothing had changed in her workout or eating habits. Like it was just that feeling of like isolation when there had been like this really strong connection. Refugee would be kind of like being cast out from, like it could be even, my example with the eating disorder girls are early on where I just felt like an outcast from that.
Yeah.
So, and I will say contextually too, we can see weight gain or we can see rapid weight loss with this. So it's just like shifts in your weight that aren't just related to like what you're taking out or like not calories in, calories out kind of thing.
It was out of nowhere.
Exactly.
Like it was like within a few weeks,
yeah,
right?
Yeah, totally. And then the existence is more like the survival. So this could be even, it's all figurative. It doesn't have to be for like legit survival, like I'm running for my life from someone, but if like, how am I going to survive this? Like the pandemic really raised a lot of red flags for people just thinking that like, is life ever going to be similar, or are we always going to be like this now, different? I could be getting a diagnosis, like a cancer diagnosis or something like that, that really just like has one questioning their existence, or any chronic illness. It doesn't have to be cancer, where there's just that going through one's head. And so we can see shifts again in weight. We can see shifts in the thyroid health, in the hormones, and just like how we're feeling in our own skin. A lot of times with the kidney collecting tubules too, there could be like some resolution, it feels like, in one conflict, but like the exacerbation of another. So a resolution could be like in your situation, you maybe found some resolution where you're like, whether it's internal resiliency, you make peace, like this is how it's going to be for a minute. I can do this. I'm a mama bear, finding the community like online or something like that within the mindshare community, something. But then there's still this lingering conflict that's unresolved. Yeah. And so it just leaves you feeling like that fish out of water.
Yeah, that's incredible. I feel like a lot of these things actually shifted for me when I moved to Austin, and I moved from Colorado to Los Angeles. My husband was having issues with the elevation in Colorado. So we kind of left our home, and that kind of perpetuated. And then we ended up leaving Los Angeles. And now I'm in Austin. I've been here for a little bit over 2 years. And I feel like it just took a while for me to like feel at home and feel part of a community, and to, I guess, resolve that conflict. So is it essentially you have to resolve the conflict, like you have to get out of the situation, or are there things that like I could have done, or there are herbs and supplements I just missed out on during that time?
I think it's a marriage of both, like physical and mental, emotional. I say like 80% is like mindset and emotion, and then 20% is like tactic and strategy. So it would be like supplemental supports and like just like the healthy lifestyle supports. But yeah, I think number one, whatever the conflicts are, like whatever the symptoms are in your body, this doesn't just apply to like kidneys. But if you have like skin conditions or gut issues, it's figuring out like what was the initial conflicts or like things going on in my life that like really set this up, like that this symptom is a metaphor for. And it's kind of like if you're in an ocean and you're standing in the waves, like on a sandbar, and a wave keeps hitting you from behind, you keep falling forward because you don't see the wave coming. But when you turn to face the wave, you gain awareness of like where the conflict is coming from. The wave comes, you don't fall. You don't fall as hard because you can see and embrace it. So at a psychological level, that's how like German New Medicine works first and foremost, is just making awareness as to like what were the root causes or cause of these symptoms. Mm-hmm. And the interesting thing about the symptom is a lot of times the symptoms can be like an understanding for the conflict. So just as I've said, like weight gain, thyroid, PCOS kind of complexes, hair loss, which would be thyroid related, we would look at something like the air conflict related. So abandonment, isolation, refugee existence. Whereas like with little Johnny, with the gut stuff and like just the intolerances with food, what were the indigestible conflicts that were happening in his life right around the same time of the symptoms? So that can help you kind of gain more awareness around the conflict. And then from there, what we kind of started the show off with was like how our words and our beliefs really can change greatly our health. So it's like we create the mantra, understand the old stories that we're telling ourselves are the current reality, create the new avatar, who you want to be from this. And then also speaking truth into it with the mantras can be really helpful. For you, it was just symptoms also heal spontaneously, or they just heal and resolve. People don't necessarily think about healing. Yeah. And even like a cold, for example, I had a cold 2 weeks ago. I hate cold weather.
Same.
Colds are related to the stings conflict. So I had a lot of nasal congestion and then some drainage happening from there. And it's like, I basically gave myself the cold because I just kept saying in my head, I hate winter so much. I hate winter. And I just like laughed it off when I got the cold because it was like, this happened, got over the cold within 24 hours of like just realizing, okay, Lauren, that's what happened. I've seen stress fractures resolve overnight, UTIs resolve overnight, SIBO symptom flares resolve overnight when we figure out the conflict and just begin to like be like, oh, my body is just speaking. It's like the domino effect. And then where the physical tools come into play, like the supplements and the lifestyle strategies and nutrition, is we can like nurture the body back to health. We can baby the symptoms with things. So with my cold, for example, I love wellness formula, like that you can find over the counter. I love propolis spray. I love some homeopathy tinctures. So I do those and it feels like I'm nurturing my body, or like I say, loving my gut figuratively in that way. So that's where the marriage of like the supplemental things, but we also know many clients and people that just focus all the energy on the physical and they're not getting better. And that's where the mental emotional really comes into play.
Yeah, that's interesting. I know I've spent a lot of time doing like neurofeedback and EMDR and just journaling and processing my emotions. And I feel like that's such an important part of the healing journey. And of course, I'm like, oh, this supplement, I'm going to try this and I'm going to try that. And so I love that German New Medicine considers a lot of that mindset, because as much as I love integrative and functional medicine, I think sometimes we can overlook some of those stressors. Like we talk about being less stressed than we talk about the adrenals, but it seems like German New Medicine goes deeper into that.
Yeah, definitely. And it's like you're no longer a victim to the symptoms. It's like a locus of control that once you identify kind of what the symptoms, we call them healing phases, where symptoms are happening, whereas like most people call it sickness or illness. It's just like the body is trying to heal now from whatever the stress was. And then where the nurturing, also locus of control then with the physical things is like, it's not like I'm gripping onto the rope harder and getting rope burn from just like trying to fix things, but it's like a nurturing approach that we take with the physical. And then that's just a beautiful marriage into healing.
So you are in remission from Hashimoto's. Could we go through the German New Medicine explanation of thyroid disease and then how, like, what would you do if somebody had a thyroid condition and they were trying to get into remission from it? Can you walk me through that approach for them?
Yeah, definitely. So the thyroid is related similarly actually to the gut. It's a morsel conflict. So not being able to catch a morsel or like extract a morsel, basically. So a morsel, that sounds like
what's a
weird.
morsel?
A morsel would be like a survival mechanism. Like, so not just food is meant to help us survive, but it's not food related. So it could be a relationship. So say a woman's single, she just really wants to be married. That could be a morsel for her. Or maybe it's something with a job. It's like never being able to like feel on top of their work or like not doing their passion. So they just can't catch their passion. So it's very unique for every individual. Sometimes like, or a lot of times it could be just like even self-care. So if like, say it's a mom of like, whether it's a single mom or a mom that's just like gone from no kids to kids now and like dealing with postpartum stuff, it's like time for herself and putting on the oxygen mask or feeling like her voice is heard amidst other voices that are like, feed me, and like taking care of her husband as well. So she's kind of like just not able to like keep up with the morsel of her own self-care. And so it's very unique for every individual. And I say she like in context because you know the statistics better than I, but women tend to struggle more with thyroid issues than males.
5 to 8 women for every man.
Yeah. So, and just thinking about like how much women are like, I mean, we sacrifice a lot of our own self-care and our own needs a lot of times for others, or just because like we've also been kind of primed by society in many ways to like just be a lesser than and just ways. And so very unique for the individual, but addressing and understanding what was the conflicts. And again, prior to the symptoms starting. So around that time in your life. And a lot of times that'll give like, just like segue into what the initial root cause was to that. And so if there was a limiting belief or story, like with my Hashimoto's journey, like it really was a residual of like, I was already going through all these other health issues. So there was a lot of like, just not being able to catch a break to be well. And so sometimes symptoms can just like spill off other symptoms. And as I began to like resolve the roots of those symptoms, my Hashimoto's begins to resolve. So, but understanding the conflict, that's where, again, creating the new belief patterns around that, or like taking back your locus of control can come into play. And then physically, it's just like I come more from the gut thyroid connection.
Yes,
Yeah.
so important.
And so supporting that pathway, since it's like, there's a lot of our active thyroid hormone that is activated in the gut, a healthy gut connection. So, and then that is also connected to our brain, our HPA axis, which is the HPA-T axis right there. So if this is our first brain, or second brain. Like if we're healing here, which is impacting that whole triad or quadrant.
So hypothalamic, pituitary, adrenal, thyroid axis.
Exactly.
Yeah.
Totally.
Yeah. I feel like that's not many people talk about that, and not many people know about the gut and thyroid connection.
Yeah.
I know I've been talking about it for the last 10 years. And when I first started trying to heal myself, I had irritable bowel syndrome and acid reflux, and I started diving deep into the research between autoimmunity and Hashimoto's and what could help. And I found an article by Dr. Alessio Fasano that talked about autoimmune disease. And he said every case of autoimmune disease has intestinal permeability, right? And if you can fix the intestinal permeability, then you can get autoimmunity into remission. And so typically you need to have the genetic predisposition, you need to have some kind of a trigger, and then intestinal permeability. In celiac disease, we know you have genetic predisposition and that gluten is the trigger that causes intestinal permeability. When we remove the gluten from the conversation, the person can get into remission even though they still have the genes for celiac disease, but celiac disease just won't be expressed if their gut heals again. And I remember going to like an endocrinology conference and asking an endocrinologist, thyroid specialist about that. And they were like, what?
Yeah.
And I just realized they don't read gastroenterology journals. They read endocrinology journals. And it's like, nobody's like connecting the dots. The research is out there. There are people talking about this, but there is a huge connection between the gut and the thyroid. And so I love that this is your approach to thyroid health. Can you tell me more about gut brain science, your 3-step formula, and how you would approach the thyroid from the gut, right?
It's so interesting too, as you're saying, no one's talking about it because it's like when you live in your own paradigm now, and like it's like that's the model of the world. I don't think the gut is just the Windex of everything, but it's like, yeah, it's connected. Like it's like you've known it for 10 years as well. So it's just like forget sometimes like, oh, the mainstream just does not connect those two.
No.
And I think this can be very telling as well when you see like a person that is maybe on thyroid meds. I see a lot of clients like that have been on thyroid meds for a long time, but like their numbers are better, but their symptoms aren't better. It's like, so they're addressing the thyroid, but they're not really addressing the gut. And so, or like the other, even mitochondrial function and the stress components, et cetera. So like more the mechanism versus the symptom. And especially if your TSH is below like 10, even like where you're more in a subclinical, and then in functional medicine, we'd see below 2 for like really is ideal. But like above 10, like over, that's mayday, like your thyroid is like under fire. Like we need to really address the thyroid. Whereas like I still look at it, there's some like wiggle room of like, let's really address the gut, even like it's above between that 4.5 to 10 range or above the 2 to 10 range. And addressing the gut is like, addressing the intestinal permeability physically. It's like cleaning up any dysbiosis present. And if you live in a westernized world, like 90% of people plus have some sort of dysbiosis that if they've never minded that part of the gut, which is basically bacterial imbalance. Some people have overgrowth of bacteria. Some people have like that wasteland again we chatted about by not eating a varied diet or a very restricted diet. So they just don't have that good gut bug army, the microbiome that is running the show. They're like the conductors of the body's orchestra, and you have more microbes than you do cells in your body. So addressing that, whether it's through herbals that we're needing to clean out some dysbiosis, or it's like prebiotic, probiotic therapy to build up resiliency and also expanding the diet. So we have intestinal permeability, cleaning that dysbiosis up, and then optimizing digestive mechanics. So, and that's like a front line early on where it's like enzymes and helping with the HCl, the stomach acid. How's your gallbladder function, which I think goes very underrated. And that's like, I think a super organ. It's like liver is Batman, the gallbladder is Robin, the sidekick that you need for creating enzymes and for creating or expelling your waste as well. And it's why when you drink coffee, for a lot of people, you have to go to the bathroom after. Is like that is it's a stimulant. It's a bitter that stimulates that gallbladder to release. And some people rely on that. So if you rely on coffee to go to the bathroom, that's telling that your gallbladder may be more congested. And so I address those on the physical standpoint a lot of times for just optimization of gut before I even look into like, let's get the parasites out, which everyone does have parasites to some degree. It's like, to what extent are they virulent or other things like viral and bacterial infections and stuff. But like, let's get the gut functioning optimally or as optimally as we can, and then see what we're dealing with as far as like how symptoms are not improving.
Yeah, I think that makes so much sense. I have seen so many people with common protozoal infections that are just kind of under the radar. A lot of tests, even functional medicine tests, might miss them. And, the kind of literature on them will be like, oh, this is a commensal protozoa.
Yeah.
It doesn't cause issues. And yet you treat the protozoa and then the person's symptoms resolve, their irritable bowel syndrome resolve, their inflammation resolves. Sometimes their thyroid antibodies go down. Sometimes their requirement for thyroid meds goes down. I think I mentioned blastocystis hominis, and I don't know. I was like, we live in a Western society. There's no way we have parasites. And when I thought about parasites, I'm thinking like giant worms and tapeworms and whatnot.
Yeah.
I had microbiology class and they were showing these giant jars. And that's not been my experience that most people have. Most people have like tiny, these protozoa that you cannot see with the naked eye.
yeah.
Like you have to look under a microscope for them. And they can definitely contribute to inflammation. There's also research on the connection between blastocystis and Hashimoto's, with a small group doing a study showing people can get into remission with Hashimoto's by treating that. And I'm going to link that in the show notes.
Oh, yeah. I love that. And I don't rely a lot on stool testing, most stool tests, because a lot of times I will miss it, as you kind of mentioned. And so I do go more based on per client symptoms, exacerbation, autoimmunity being present, et cetera. And just like recognizing that that can be a great part of the healing totem pole. I'll give an example. Even I think aesthetically too, like, and I can send you some before and after pictures, but it's like I had contracted a parasite in Mexico like a year ago. And just like one bad meal, whatever. And so 24 hours, if you've ever been exposed to food poisoning, it's like there's bacterial and parasitic like likelihood there that are like a lot of times IBS, for example, if you have IBS, can be preset by something like a one night of food poisoning.
Absolutely. There's so much research to support that.
So it had led to a lot of inflammation, especially like in my eyes. And so where I was seeing like really, really deep bags under my eyes. And it's just like, that was like the only thing I could think of that had changed in my like life, or like the stressor that had happened. And as I've like treated the lymphatic system and like kind of like obviously the gut as well, the bags have gone down significantly. And so it's like where, like, even if we're thinking like skin wise and like just the whole beauty and aesthetic industry is definitely not looking at just like the inside too, and how you could improve that to improve your body physically.
Yeah, it's so interesting. I know a lot of times people believe that when they get food poisoning, that they just kind of clear things, that they just work their way through. And I think it's true that the initial like hardcore symptoms, they may not remain with you, but if it's a parasite, that can stay in your system and sort of make peace with you to a degree. So it like, you're not necessarily having chronic diarrhea all day, every day like you would, or vomiting, but it could still cause low-grade inflammation, leading to autoimmunity, leading to IBS. And I see this so often where people are like, oh yeah, I had food poisoning 10 years ago. And then we still see like, if we do like a really great test, we might be able to see, oh yeah, this thing is still inside of you and we actually need to address it. And then the symptoms start shifting. And I mean, it's not like an overnight thing, because it does take a little while to repair the gut lining, but it'll happen within, a few days to a few weeks. Usually within 2 to 3 months, you'll kind of see the full effects of like that intervention. And it's something that a lot of people they just think it clears. And I'm like, it does not clear.
Exactly. Just, well said.
It's still there.
It is. So addressing it can just be a great like up level.
For sure. Yeah. I wanted to ask you a couple of rapid fire questions.
Yeah, here for it.
That's okay with you. What would you say to a person that keeps getting more and more chronic illnesses despite trying their best?
I think when given the right tools, your body innately wants to heal itself. So knowing that full and well, if you break a bone, you slap a cast on it, it heals like 6 to 8 weeks. Even if you don't slap a cast on it, it's fighting to heal. And so just knowing, like, hopefully this conversation has opened one's mindset too to like the broad spectrum, that it's not just about supplements or restrictive diets for healing. And those like that 80-20 of like mind and emotion as well can play a huge role. And like, just you are a creative author in your life too. So we are the stories we tell ourselves. There's a great book, The Power of the Subconscious Mind. I highly would recommend for taking your power back.
I love that. Your go-to gut health products as a gut expert.
Oh man, I just love good old digestive enzymes. Like honestly, like not all enzymes are created equal. I love Steve Wright's Healthy Gut line. I don't know if you've ever seen his, but
Oh, I love Steve Wright.
yeah, he's
the
great.
best.
But yeah, that I would say was one of the biggest game changers after years and years of bloating. I also love ionic magnesium, which is just like a full cellular magnesium. That's really great for bowel health as well as sleep for some people. And good quality water.
Yeah.
Yeah.
Do you use a water filter or do you add minerals to your water? Tell me more about that.
I do a blend. I do add minerals to like distilled water, or just like the reverse osmosis water. And then I will do Kangen water occasionally, just like, and I love the Mountain Valley spring water. Yeah.
Interesting.
Yeah.
Katie, our producer, was just talking about Kangen water and what a game changer it's been for her.
Yeah. So. I like to mix up my water sources, but they're all pure water sources. Yeah.
That's great. I'm a big proponent of filtering water. I know this is maybe controversial in conventional medicine, but it's such a common knowledge fact in functional medicine or integrative medicine, but fluoride in the water supply can suppress thyroid function. Fluoride used to be used as an hyperthyroid medication before they invented other more powerful drugs. So if you give somebody enough fluoride, it'll suppress their thyroid function. So I'm a big proponent of filtering water when you have a thyroid condition. And hopefully things will start shifting with fluoride no longer being recommended.
Yeah.
Okay, favorite gut tip.
Oh gosh. I think it's like 80-20 balance. Again, like a little dirt never hurt actually is really great for a robust microbiome. And I think that's something that's anecdotal. So when it comes to like food freedom and just remembering like our mind is a big, like the gut brain connection is a big piece of the puzzle.
I love that. And last but not least, favorite thyroid tip?
I think, like, that's a great question too. I think addressing, like, understanding the root causes, like, of the morsel conflict and, like, really pouring into yourself. So for example, if the morsel conflict was something around, like, you sacrificing your needs for someone or something else in your life, like, really what sparks joy for you in your life? Like, getting back into joys. Like, mine has been hip hop dance lately. I absolutely love that. But I think tapping into, like, passions and like what makes you tick as a person can be a really like underutilized and talked about component of healing as well. And like putting on your oxygen mask figuratively, feeding your soul.
It's interesting you say that. My adrenal transformation program that I developed for women with fatigue and brain fog, one of the strategies that I use with it is pleasurable activities and just doing things that you love, because I feel like a lot of us are not fatigued because we do too much, but we're fatigued because we're not doing enough of the things that give us energy.
I love that.
Yeah. And they say their energy shifts and it changes when they're actually doing things they're passionate about and having something to look forward to.
No, that's energy boosting right there.
Yeah. Isn't that amazing? I love that. I love that you do the same.
Yeah.
What do you I lied. This was not the last question. My eyes skipped. Okay. What do you wish more people knew about healing?
I think like your diagnosis is not your destiny. So just you are like, kind of always said, we are the story we tell ourselves. And if we accept that, like, it's kind of like what I said a little bit earlier, the body is wired to heal. So you did not come into this world like a sick being. And so your body has the capability, and it's just figuring out like what are the right tools to support your body back to health, and or creating the environment externally and internally that is just optimizing for that health.
I love that. I wanted to check with you before we wrap up. Do you have any special gifts for our audience that you'd like to share?
Yeah, I have a 3-day gut cleanse available right now on my website, drlauren.com, and my upcoming website, totalgutreset.com. And I'm really excited. It's gotten a revamp most recently too. So that will be available for free.
Thank you so much for providing that. I'm going to put the link in the show notes so people can see that. And where can people learn more about you and your work? Where can we find you?
Yeah, so it's Dr. Lauryn everywhere is my handles. So DRLAURYN, and then drlauren.com, and then my website, totalgutreset.com.
Amazing. Dr. Lauryn, thank you so much for joining us on this healing conversation. You are such an inspiration. You've been through so much and you've overcome so much. And I love how you're taking your life lessons and then you're using everything that you've gone through to help others heal. Thank you for the work that you're doing in the world. And thank you for taking time out of your busy schedule to join us here today. For everybody joining, thank you so much for joining the Thyroid Pharmacist Healing Conversations podcast. I hope this conversation has been healing on your personal health journey, and I hope to see you soon again.